Good evening again to all participants. Good day to all of you. Welcome to the V Project 2021. To ensure that this webinar is running smoothly, to all our UKM Year 1 Medic participants, kindly rename your Zoom account using to this format, group name dash your name. During the Q&A session, we would like to remind you again that kindly introduce yourself before asking any questions. Mention your names first, your year of study, and your university. You may address your questions in the chat box throughout this webinar session. The questions will only be answered during the Q&A session, and kindly be reminded to fill in both the attendance form and feedback form. The QR code for attendance form will be presented on the screen, and the QR code for the feedback form will be presented at the end of the session. And to all the UKM Year 1 Medic participants, you are required to fill in both forms for your attendance and to contribute your V points to your respective groups. We are proudly sponsored by our platinum sponsor, Duplex Malaysia Company, our in-kind sponsors, Cocoland Holdings Berhad, Greenhouse and South Plus, My Burger Lab Company, and Printicious, and last but not least, New Era Enterprise, Artline, and Zebra. Once again, good evening and a very warm welcome to our honorable speakers of invite, Professor Datuk Dr. Zulkifli Ismail, along with Dr. Ahmad Firdaus Muhammad Haris, and all the ladies and gentlemen to the ABCs of Vaccines webinar, the first webinar of the V Project 2021. My name is Alisha Jamali. I'm a Year 1 medical student of University Kebangsaan Malaysia, and I'll be your moderator for tonight's event. There are many interesting sessions planned out for all of you today. Without wasting any more time, let's get going and make sure to keep your enthusiasm in check. Before we start, allow me to introduce you to the V Project 2021. The V Project 2021 is an ambitious 34-day-long online vaccination awareness campaign by the Medical Society of UKM Faculty of Medicine. We are proud to announce that we are the first university student movement to educate the public about the importance of vaccines and vaccination, especially with the ongoing COVID-19 pandemic across the world, increasing trend of anti-vaccine beliefs and ideas, as well as some misconceptions about vaccines. Our ultimate goal is to boost the public confidence over the efficacy and safety of vaccines. In tonight's session, we have two credible speakers today who are Professor Datuk Dr. Zulkifli Ismail and Dr. Ahmad Firdaus Muhammad Haris. Before we begin, I would like to give a glimpse of both of our speakers tonight. Dr. Ahmad Firdaus bin Muhammad Haris is well known to be the president and co-founder of Medical Mythbusters Malaysia, which is a health advocacy non-governmental organization formed in 2016. With the aim of empowering the public on health issues, Dr. received his Bachelor of Medicine and Surgery degree from International Islamic University Malaysia in 2009 and received his postgraduate certificate from Harvard Medical School Southeast Asia Healthcare Leadership Program in 2020. Currently, Dr. Ahmad Firdaus is the medical officer in charge of the Non-Communicable Disease Control Unit programs in Perak. In 2017, Dr. Ahmad Firdaus was also certified with NCD Leads, which is a program organized by the Ministry of Health's Non-Communicable Diseases Unit to create champions on NCD issues at every state the following year. He is also a fact checker for Health Analytics Asia and a fact checking team based in Southeast Asia. Now, on the other hand, I would like to give a preview of our second speaker. Professor Datuk Dr. Zulkifli Ismail is a consultant pediatrician and a pediatric cardiologist at the KPJ Selangor Specialist Hospital and a visiting pediatric cardiologist at the KPJ Damansara Specialist Hospital. He was formerly a professor of pediatrics and pediatric cardiology in our very own University Kebangsaan Malaysia. He has also served as the head of pediatric department and the director of Hospital University Kebangsaan Malaysia, as well as the medical director of its private wing before opting for early retirement from the academic world in 2005. He is currently a clinical professor with the KPJ University College of Medical Sciences. Other than that, Professor Dr. Zulkifli has also served as the past president of the Malaysian Pediatric Association, MPA, and is currently the editor of Association's quarterly newsletter, Berita MPA. Professor also chairs the technical committee of the Immunized for Life program since its inception in 2013. Professor Datuk Dr. Zulkifli is also currently the Secretary General of the Asia Pacific Pediatric Association after serving as its president from 2012 until 2016. In 2008, Professor was conferred to the Darjah Panglima Mahkota Wilayah by the Malaysian king that carries the honorific title of Dato'. And in 2012, APPA recognized him with the Outstanding Asian Pediatrician Award. With that, I would like to invite our first speaker for tonight, Dr. Ahmad Firdaus, to begin his sharing on the ABCs of vaccines. The Zoom is all yours, Dr. Ahmad Firdaus.
Hi, Assalamualaikum warahmatullahi wabarakatuh and good night. Good evening, I mean. Thank you, Nur Alisha, for that wonderful introduction. Let me share my slide first. Okay, let's set some ground rules first. My presentation will be quite light. Usually I would allow you guys to submit the questions straight away, but due to the webinar setting, so I'll answer the questions later. You may ask the questions via the Q&A section, and I'll be pleased to answer them later. Okay, on my part, I'll be focusing on the introduction on what is a vaccine and also the types of vaccine regarding COVID-19, and I'll put in some medical myths that we can counter throughout this presentation. Okay, let's start. So what is a vaccine? Vaccine is a product that stimulates a person's immune system to produce immunity to a specific disease, protecting the people from the disease. So this, I think, for medical students, this should be something kacang kan. It's something that easily understood. But for the lame person, it might be a bit difficult for them to understand. So this is how you can explain about vaccine to the general population. So it relates to antigens. So what is an antigen? It's a substance that can cause immune response in the body by identifying substances in or markers in markers or on cells. Okay, so meaning that we introduce something to the body. Okay, later on I'll present further. The antigens are not harmful to the humans as a substance is only part of a virus structure or a virus in a weakened form. So I'm highlighting this because for COVID-19 vaccine, there's two types. I mean, there's multiple types. So it may be a weakened vaccine, mRNA. So the important thing, it's a representation of the virus itself. Okay. So the antigens will stimulate the immune system to produce the antibodies, and antibodies will allow the human body to develop an immunity to a particular antigen. So this is a normal process. So this is something natural. It's just that we are introducing something to the body for the body to produce something that is natural. So as in a simpler word, in simpler terms, vaccines train the bodies to produce natural immune system. I mean, it trains the body's natural immune system to ward off viruses or bacteria. And antigens in vaccine triggers these antibodies to antibody production. And these antibodies will remember the structure of particular viruses. So we call it antibodies have memory function. Okay. So when the body is exposed to a virus, antibodies work to prevent a full-blown infection and its complications. So it's more like training an army. So when you train a soldier, you want the soldier to know how it looks like. For example, if a soldier doesn't know how an enemy's helicopter looks like, it will be too late before they do something or identify the helicopter. Okay? So trained antibodies will act faster to prevent a full-blown infection, and if a prevention does occur, the complications would be less, or there won't be any complications arising from the infection. In this case, for COVID-19, we are looking for prevention of the disease itself, and if there is no prevention, even if someone acquires the virus, they would not get a full-blown infection. So we won't get the complications that arises due to COVID-19 infections, such as being admitted to the ICU. So they might be having some mild disease forms of COVID-19. So what is the main objective of these vaccines? First is to protect the frontliners. We've heard this all along since last year. It's always the frontliners. So this is to protect the frontliners. Second is to protect the high-risk population. This is something that people always are confused with. It's not, when we say high risk population, it doesn't mean that we are targeting people who are at high risk of having complications due to the vaccine itself. So what we mean by high risk populations are the ones with non-communicable diseases such as hypertension, diabetes, and obesity even, and also asthma. So by virtue of the disease itself, and we can see with the daily reports from the Ministry of Health, we can see that most of the deaths occur due to the elderlies and also those with underlying diseases, underlying non-communicable diseases. So that's why we want these people to be protected from the COVID-19 infection. Then we are after the herd immunity, which what I will explain later. And later on, we will hopefully with the vaccine itself, there can be some pandemic control. We want to control this COVID-19 pandemic. It's been a year plus. It's been tiring. We can't work properly. It has effects within the economic system, education. We can't travel. So this is something we need an urgent solution to. Okay, you can see that there's some poor. I wouldn't say apa. It's not some Photoshop, but it will make do to understand that this is about medical myths. Okay, one myth that people always associate with vaccine is it's one ring through them all. It's like the Lord of the Rings ring. So there's no one vaccine for all diseases. So for COVID-19 vaccine, it's just for COVID-19. For measles, it's just for measles. Unless it's MMR, then the mumps, measles, and rubella. So because the public always say that, oh, that person vaccinated himself, but he still has fever. Why does he still develop a disease? Why is he not so well? So you need to understand that it's not a silver bullet that can cure everything. It's something that works for one specific infection only. So this is how herd immunity forms. It's quite boring, this picture. So I take you to another picture. This makes it uh, more easier to understand regarding herd immunity. So if you see there's you can see people who has umbrellas, those with smaller umbrellas, and then there are people who does not have umbrellas. So those with the umbrellas are the ones who are vaccinated, and those without the umbrellas are the ones not vaccinated. Not vaccinated not because they're anti-vaccine, but unvaccinated because they cannot be vaccinated, such as those within the less than 18 years old, those with diseases that render them they cannot get vaccines, those with anaphylaxis before this. So they are not liable. They are not they cannot be vaccinated safely. So when you see this picture, you can see that for one umbrella, there's some space there, right? So you can fit in like 2 or 3 elderlies, 1 or 2 kids. So when there are more people with the umbrella, you can imagine like if you guys have seen Godzilla, that awful movie in 1998, you can see that when everyone brings up the umbrella, opens up the umbrella, almost everyone will be protected from the rain. So the rain represents the infection. Umbrella, when more people have umbrellas, they will be prevented from getting the infection. Okay. So our target for COVID-19 vaccination program, or the term today is PICK, Program Imunisasi COVID-19 Kebangsaan, PICK. So the target for Malaysia is actually between 70 to 80% of the Malaysian population needs to be vaccinated in order for herd immunity to be there. Okay. So thus we have been spending around 2.05 billion ringgit to acquire vaccines to be vaccinated to 26.5 million Malaysians. So that would be 80% of the population. And the red part is the most important of all. It's free of charge. No one has to pay. Everything is provided by the government. Then this is a public health approach. So some people say, how come when we give vaccines, we still need to wear masks? We still need to do social or physical distancing, hand hygiene, and so on. So if you can see, this picture represents a Swiss cheese Swiss cheese model. So Swiss cheese meaning when if you can remember, I'm not sure if you guys watch apa nama, what is it called, Tom and Jerry. Jerry likes to have those cheese, and this cheese would have multiple layers with multiple layers having some random holes in it. So these holes represent problems. That means each one of these solutions, such as physical distancing, hand hygiene, face mask wearing, is not perfect. So you line this up together so that hopefully uh, the these I individually these methods are not perfect, but when you put them up together, it will be perfect to prevent the disease from spreading. And vaccine is the last puzzle in this Swiss cheese model. So that's why we need everything. So imagine like having a car. Okay, if you drive a car, if you have brakes, do you still need ABS? Do you still need airbags? Yes, you do. Even if so, you still need to wear your seat belts? Yes. Okay, but individually they are not as efficient as all three together. So all these three methods would help you save lives. So this is the same as all these public health measures that are in place. So another medical myth busting. So now we go to the what is it called, the vaccine process. How do you make vaccine? So if so fast make vaccine, sure got nano chip one, correct or not? So if you can get all this sure got some problem one, correct or not? Okay, why is it so fast? So why is it so fast? It is because all these three measures or these steps are in place. So there's the technology, data sharing, or also parallel trials. So in terms of latest technology, there's rapid advancements of technology. Compared to previous years, we can do things at much faster rate. mRNA, although we've only heard of it recently, but it's actually around for quite some time, for more than a decade. So this method gives us that opportunity to not require the need for cell cultures, which is a tedious process. Then there's also funds from multiple agencies and global communities. So a lot of money is coming in because there is no country spared from COVID-19. If you go to New York, if you go to America, you go to Europe, everyone is affected. So they want a solution fast. So they put in a lot of money. Without COVID-19, without managing this pandemic properly, our economic system will crumble and every country would fall. So for mumps vaccine, if you look at it, it was developed, it took 4 years to develop. So previously, this was the fastest vaccine to be developed, and it was approved for use in 1967. That was around 50 plus years ago, if I get it correctly. Okay. And we look into this picture. Okay, on the left, some of you may not know what this is. This is a Nokia 3310, a legend of phones. You can throw it to a dog and the phone won't break. The dog would have some problem, but I don't recommend anyone from doing it. This is a legend. And then we see what the phones are like today. So within a span of 10 to 11 years, we see a massive development in the technology sector. So if you expect your phone to be from that Nokia 3310, that Snake, you just play Snake all day long, to something that you can play everything from PS5 games to Nintendo games. So this is something that you need to consider. You cannot expect vaccine technology to be the same for the past 50 years, but you expect your phones to be progressively faster within a short period of time. So you need to tally between the two. This is what I mean by technology. Then there is data sharing. Information technology allows data to be shared in real time, meaning one research can be done in China and the other person in New York can know what the results are within a few minutes. Compared to the past, whereby you need to print it out first, you need to verify, print it out, and then you need to courier it, send it to the other side of the world. So now everything happens in a blink of an eye. So, for example, the genomic sequence of SARS-CoV-2 was shared immediately to researchers upon detection. So everyone, once they got this genomic sequence, they can readily make, or they can try and produce the vaccines based on the genomic sequence received. And this information is also readily available in the web. I'm quite tired of people saying, "Oh, how come I don't know about these vaccines? How come why are people making this all in secret? Why can't they tell everyone?" Well, if you search for uh, vaccine or coronavirus is Bill Gates is behind all this coronavirus, then that's what you get. But if you actually search for coronavirus vaccine, this is an example of a coronavirus virus vaccine tracker. It's been around since last year. You can actually see the improvements or the various vaccines in process. It's very transparent. You can see it readily. Okay. Then there's also the parallel trials. Compared to previous years, for the past vaccines, each trial, phase 1, preclinical trial, phase 1, phase 2, phase 3, and so on, each phase would require around 5 years, 3 years, and so on. But now, due to the need for this vaccine to produce quickly, they are doing it in parallel, meaning all these phases are being done together at once in multiple centers all around the world without compromising on the safety and efficacy monitoring. Okay, so this is how rapid it was developed. SARS-CoV-2 was sequenced in January, middle of January, if I'm not mistaken. And then by March, there was already clinical trials, and by October, November, there was already some positive results, and in December, vaccines were already being deployed worldwide. So why are there so many types of vaccines required? Because you can see there's like 47. This is just a part of it. There's multiple vaccines, thousands or hundreds of vaccines are in process of being developed. So why so many for just one COVID-19 disease? Okay, because we need to combat the pandemic as fast as possible. So the vaccine rollout we need to be, quickly, as fast as possible, and we want it to be cost efficient. We don't want any one company to monopolize the vaccine. So when there are more vaccines available, then there will be no monopoly from any of the pharmaceutical companies. And each vaccines, we need to remember, I'll explain further later, has different temperature range and its efficacy. So this may suit certain countries. Countries without proper facilities may not be able to maintain that minus 70 degrees Celsius temperature required for Pfizer BioNTech vaccine. So these are the types of vaccines available for now. There's many more, but you can see here some of the listed ones. So I'll explain I'll just touch a bit on 3 vaccines because due to the difference in the type, difference in the way of action. So one is the current one being used is the Comirnaty vaccine, BNT162b2 from Pfizer BioNTech. This is the only one being used in Malaysia at the moment. It is a mRNA type of vaccine with an efficacy of 95%. 2 doses 3 weeks apart, and it has to be stored at minus 70 degrees Celsius. And it's only approved for use for above 16 years old at the moment. I've just received the second vaccine dose yesterday. There's some, it's not serious reactions. It's more like I have a low grade fever, but I don't have any fever. It's just a bit lethargic and some myalgia. So this is how it works. mRNA vaccine, it does not use a weakened virus. It does not cause COVID-19. And mRNA is a messenger. It's just a postman. So mRNA delivers the structure of the COVID-19 or SARS-CoV-2 virus. So it represents the spike protein. It presents it to our DNA to produce proteins or to produce antibodies to fight off the coronavirus, the SARS-CoV-2. So in compared to other vaccines, this is faster and easier to produce. It's very synthetic, it's very sterile, and it doesn't use any of the other components in other vaccines. Okay. Then there's the Oxford Astrazeneca vaccine produced by University of Oxford. It's AZD1222. So this is a non-replicating viral vector with efficacy of 90%, 2 doses, 4 weeks apart, maintained at the temperature of 2 to 8 degrees Celsius. So it does not require extreme temperatures like Comirnaty just now. So due to it being non-replicating viral vector, so it's a vector. So it needs to in Malay, it's like it needs to tumpang on another virus to deliver that information. So it delivers the spike protein via ChAdOx1. ChAdOx1 is a type of adenovirus which infects chimpanzees only. So it does not cause any infection to the humans. So it just delivers the SARS-CoV spike protein so that the body would know what to look for. Then this is a CoronaVac developed by Sinovac. This is from China. So the efficacy rate is more than 50%. However, there are emerging studies that shows that the efficacy is even better than 50%. 2 doses also, 2 to 8 degrees Celsius storage. And this is a conventional vaccine, meaning it uses inactivated virus. So SARS-CoV virus are weakened. Weakened virus does not cause the infection. It doesn't cause any infection. So this virus is weakened synthetically, chemically, and it would be introduced to the body, and the body would identify it as a virus and produce the antibodies. So although it's weakened, it will retain the viral structure. It's the virus structure that's most important in this aspect is the spike protein. Okay. So there's no song here, but I use X-Men because there's myths going around that mRNA vaccines changes a person's DNA. Maybe becoming, if become Wolverine, okay also, right? But they might they say it causes cancer and things. So as far as we know, mRNA does not change it does not change a person's DNA. It's a messenger. So it just delivers. It's like a postman. It delivers the information of the virus to the body, and then it will die off. So it will denature by itself. It doesn't stay in the body. So that's I think that's a quick one. Hopefully this what I've presented is clear. What I'm looking forward is to the Q&A sessions. Usually the question and answers are the ones that I would answer properly. And so I pass the mic to the chairperson, Aisha.
All right. Thank you very much, Dr. Ahmad Firdaus, for the amazing sharing. I really like how you made the analogy of brain becoming the infection or the virus and umbrella becoming the vaccine. So I guess in the future, we all hope that everyone gets our own umbrella. Now we know the general overview of how vaccines actually work. We also are now aware of the misconceptions encircling the vaccine. We believe that all participants will benefit from it. So without further ado, I would like to invite our second speaker for tonight, Professor Datuk Dr. Zulkifli, to share his perspective on this topic. Now let's all give a very warm welcome to Professor Datuk Dr. Zulkifli.
Thank you. Thank you, Alicia. I'll just share my slides with you. And thank you for that very kind introduction earlier. Okay. Mine is going to be a bit more dry compared to Dr. Firdaus' talk, and I don't have the kind of analogy that he uses. We were actually given quite a huge number of things to cover, and this is the list that I got earlier. But I'm just going to take you through. I'm not giving you a medical lesson here. We're going to go through some history, and then we're going to talk about the law, and then we're going to talk about some policies and strategies, and then we're going to end up with vaccine hesitancy and refusal, and then lastly end up with what I see as other vaccines that are in development. And you all know who this is. This is Edward Jenner, who is credited with introducing the smallpox vaccine using cowpox. But actually, he was not the first one to do it. In China, they were already doing this in the 3rd century AD. And with that amount of variolation that they did in the beginning, the Chinese actually reduced the mortality rate from smallpox from about 20 to 30% to only half to 2% only. But that was not the only thing. The Muslims in the during the Ottoman period in Turkey were already doing smallpox vaccination. And this lady, who is Lady Mary Montagu, she was the wife of the ambassador to Turkey. And when she was walking in the streets, she saw these old ladies who actually did smallpox inoculation, and she saw that all of the Turkish women had skins which were very smooth. Now she had been infected by smallpox, so you can imagine this picture is probably photoshopped. Her skin was probably very pockmarked, and in the end, she actually had her son vaccinated, and he did not get smallpox. So actually, the history of smallpox vaccination, went way before Edward Jenner. And because of all that, this kind of faces have disappeared from the face of the earth in 1980. That was the year that smallpox was eradicated. Now, following this, a lot of other diseases have already gone down, including polio, measles, and diphtheria, and all over the world. And this has led to the development of a lot of other vaccines, as you can see here, over the last decades throughout the industrial era, ending up with the HPV vaccine. And then now we have the COVID vaccine. And the reason why the COVID vaccine is being introduced so fast, much faster than the 4 years of mumps, is because the technology had already been there since the 1990s. The messenger RNA technology was already there, and they were already working on this when they were working on Ebola virus vaccine, they were working on HIV vaccine, and they just needed to polish it up, and there was a lot of money that was pumped in, so there was no issue. Now, what about Malaysia? I just want to give you this history of how Malaysia, the history of the Malaysian vaccination scene. We started our vaccination for smallpox in the 1950s. And in 1960, we started DTP, which is diphtheria, tetanus, and pertussis, and BCG was started in 61. And polio, there was a polio outbreak in Batu Pahat in 1972, after which the oral polio vaccine was introduced. And then in the 1980s, we had measles, rubella, and hepatitis B introduced all in a row in the 1980s. During the 1990s, which was the period when I think a lot of you were born, this is the time when there was a economic crisis. So not much money was around, and we did not spend any on vaccination. But after that, we had MMR and HIP in 2002, DTP with hepatitis B and HIP in 2006, and then the 5-in-1 in 2009, and HPV in 2010, all in sequential order. And for the next 10 years, there was nothing. Then in 2020, we had the pneumococcal vaccine, and we had the 6-in-1 hexavalent vaccine, which is introduced also last year. Now, I'm not going to go through the immunization schedule, because you should remember that by now, but this is the history of vaccination in the country. And what's the result of all this? The result is we have had a decline in cases of diphtheria, we've had decline in cases of polio. This is the cases of polio, and this is polio vaccination, which has gone up. And then we had also decreased in cases of measles. And in order to continue with that, we need to have continue with vaccination. If we break the vaccination, then there will be no, we will come back, just as we had cases of diphtheria recently, and we had cases of measles coming up. Now, vaccination, and let's go on to the vaccination and the law. The questions that I want to ask, and the questions that you actually may think for yourselves now, as well as when you graduate, is, do we want to make vaccination compulsory or mandatory? And we have to know what are the other countries around the world doing, and also what our neighbors are doing. But more importantly, what penalty do you think should be meted out if you make this compulsory? If you make something compulsory, you have to fine people like $1,000, $10,000, or whatever. So let's look at what's happening in all the other countries. This map shows you countries where there is evidence of a national policy that mandates vaccination in red. So there are 62 countries altogether that makes it mandatory. And then there is also penalty associated with penalty. You might notice that America and Canada are not there. They are gray, which means there's no evidence of a national mandate. And the others, where the orange ones are the ones where there is some national mandate, but there are no penalties that's identifiable. So if you break down those to some of the other countries, I've selected a few here. Now, when we look at Canada, I told you there is no national mandate, but then some states are very independent. So Ontario and New Brunswick have got a mandatory for DTP and MMR and IPV, and then so is Manitoba. And then in places like Italy and Italy and Slovenia, they actually have a penalty. So in Slovenia, if you refuse vaccination, you're fined euro 41 or euro 417 per parent. And in Italy as well as France, is mandatory before they go to school. In the United States, there's no national mandate, but all the 50 states actually make it compulsory that children attending schools have to show that they have been vaccinated against diphtheria, tetanus, pertussis, polio, measles, rubella, and also varicella. Now in Korea, there is no real mandate, but it shows that they actually make it inform people that there are things that that need to be given. Now in Australia, it is no jab, no pay, which means that if you don't get vaccinated, you lose the family tax benefit, which is 15,000, which is a substantial amount. Now, in places like, so there are different here, penalties as well as schools, and where they're not allowed to go to school if you, like in Mexico, you have to show a complete vaccination record. So there are different ways of penalties that you can give. As far as our neighbors are concerned, all of these countries, Thailand, Myanmar, Laos, Vietnam, Cambodia, have got no actual mandate on vaccination. Brunei and Singapore, there is a penalty of $5,000. But speaking to the people in Singapore, so far nobody has been fined the $5,000. In the Philippines, it is not mandatory or compulsory, but they make it, they inform that these are the vaccines that should be given to people, and they're given free of charge. Similarly, in Indonesia, it's also not mandatory. So in Malaysia, well, we tried to make it mandatory or compulsory at one time, but 2 or 3 years to go, but it's not. So now we have to make sure that the public is properly educated on vaccination, and we have to make sure that every a person who is eligible can have access to the vaccination. That is what we're supposed to do if we don't have it mandated. The guidelines and policies that the Ministry of Health follows when they want to introduce a certain vaccine will depend on the World Health Assembly resolutions, which comes every year, and also based on WHO position papers, as well as regional TACs or technical advisory groups on vaccine preventable diseases, and also on outcome of the National Health Technology Assessment. The Health Technology Assessment, or HTA, is a division in the Ministry of Health that looks at all new appliances and vaccines, and they will give an input. And also they look at disease epidemiology and proposals from national professional bodies like the Pediatric Association, the Malaysian Medical Association. And so it's good for you when you graduate and you subspecialize or specialize, to join these professional bodies, because then you can make a difference to the country. And it's also in line with local and international requirements. There are elimination strategies which the WHO have targets for, and we at the moment are supposed to target the measles elimination target. The measles elimination was supposed to be, Malaysia promised that we would eliminate measles, which means less than 1 per million case per year by 2018. But as you know, we had to push it now to 2021, and then now we're pushing it to 2023. So hopefully we can do this, provided we can get more than 90% of the population vaccinated with MMR. The disease, when you want to recommend a vaccine, or when they want to recommend vaccine, like for instance, the Hib vaccine, which was introduced in 2002, we, the Malaysian Pediatric Association, went and told the Ministry of Health to do that from 1995, I think. And then it took us 7 years before the ministry actually took that on. And it will be based on the burden of disease, like morbidity, mortality, and also outcomes such as death, paralysis, school or work days off, and the potential to cause outbreaks like enterovirus 71, which causes the hand, foot, and mouth disease, and then encephalopathy, and then influenza virus, as well as COVID-19. But of late, they also look at cost-benefit and cost-effective data. So, and some of you, I just want to pause for a while here. Some of you at the end of your 5 years or 6 years course, you will want to, a lot of you probably go into the surgical specialties. Some of you will go into the medical faculty, medical side, and then some will become pediatricians, some will become, other specialties. And the rest will take up public health and become GPs. Now, what this pandemic, this COVID pandemic has taught us is that there is a big need for public health people. So those of you who think that public health is a very low level kind of specialty, please reconsider, because it will become very important when you have pandemics like this, and especially if you are very tech savvy. Okay. Now, then what are the KKM methods to encourage vaccination? Well, they plan to introduce this in the school syllabus so that children will know about the vaccines, and they'll probably talk about the different diseases that have been prevented, like what I told you earlier. And then they want to empower the healthcare providers as well. We have started an immunization educator teams in the government clinics. And then they also recognize the role of religious leaders and influencers, which they use. They now identified subpopulations which will enable them to actually address vaccine hesitancy and refusal in a very targeted manner. And then they're also encouraging the public to report healthcare providers who discourage vaccination, and then the sharing of responsibility with private healthcare sectors. And then there is a committee, the National Immunization Policy and Practice Committee, which is the highest level of technical and advisory working group on immunization and vaccines. And it's also a decision-making body. These are the terms of reference, but it's not important for you to know all that now, but you know that the Ministry of Health works in a very coordinated and coordinated way. Let's go on to vaccine hesitancy. WHO has identified 10 threats to global health in 2019. And these are air pollution and climate change, non-communicable diseases, global influenza pandemic, fragile and vulnerable settings, antimicrobial resistance, Ebola and other high-threat pathogens, weak primary health care, and vaccine hesitancy, and then dengue and HIV. Now, so vaccine hesitancy is one of the 10 threats to global health in 2019. And vaccine hesitancy is not new. This happened even when during the time of Edward Jenner. In fact, this was a caricature in the newspaper showing cows coming out of people's appendages and bodies because they was given cowpox from the serum from the cowpox. So that was without internet. Now with the internet and with social media, the news will spread much faster. And when you look at vaccine hesitancy, there is a continuum of it's not a static thing. Not all, you expect that people will accept vaccines mostly, but there will be a few at the bottom here who will be denying vaccines and also be refusing vaccines. In the middle will be the hesitant ones who may take it but with caution, or who may postpone and be selective about what they take. They may want to take the DTP, but they won't take the MMR vaccine. They may take the MMR, but they won't take the COVID vaccine. So the idea of vaccine advocacy is to try and convince people in this group to go to the group that accepts the vaccines. Probably not without question, but maybe answering their questions. On the other end of it, there are those who are promoting anti-vaccine rhetorics, which they will say that they raise safety concerns, toxins in the vaccine. They raise conspiracy theories. They say that breastfeeding is enough. There's no need to vaccinate. They create fear about AEFI or adverse events following immunization, and then they bring up religious concerns that it's not halal and so on. So these are issues that are bring up. The number is small, but they make a loud noise, and this loud noise actually causes misperceptions among parents, and parents will then err more on the side of hesitancy and refusal. So let's look at some data. Now, this is from the Lancet, published in September of 2020. It compared in November 2015 with November of 2018 here, and looked at the questionnaire to whether people actually will accept vaccine safety, importance, and also effectiveness. And as you go from blue to red, the more denying they are, or the more hesitant they are. The more blue, the more accepting they are. The darker the blue, the higher the acceptance at 90 to 95%. Now, if you look at this, let's take an example. Take Australia. Australia, in terms of safety, the population thought that it was okay, about 70% in 2015, but it dropped. The population thought it was less safe in 2018. But they thought it was more important over the years and also that it was more effective. They thought it was more effective, but there was an issue with safety. So the countries that actually did well and where they had improved between the thing is in the EU countries, but the ones that fell were countries like Afghanistan, Indonesia, Pakistan, Philippines, and South Korea. And when you drill down further and look at where it is, this is a chart that tells you anything that goes behind this line means that's a decline from 2015 to 2018. Anything out to the right is better. So when you look at it, you see Indonesia, South Korea, Philippines, and Malaysia have all dropped in terms of the belief that vaccines are safe, important, and effective. Now, what about, this is data from Ministry of Health. This is vaccine refusal in Malaysia by numbers. So you can see that this is taken from all of their clinic kesihatan. So you can see that from 2013 to 2015, there's a marked increase and then slowing down, and then it plateaus after that. And when you look at the data, you will see that most of the vaccine refusers are Malays, 92%. About 61% were housewives, but note here, almost 20% of them were actually professionals in the government service, which means these are teachers, doctors, dentists, and pharmacists who are in government service. All right, and then in terms of education, most of them, 55%, were secondary educated. But look at this, 1/3 of them were actually tertiary educated, people like you and I, who actually have gone to university and they believe that they are vaccine refusers. In the worldwide setting, vaccine hesitancy by WHO has been attributed to a lack of knowledge or awareness about vaccination services, experience with past vaccination, as well as religious, cultural, and socio-economic factors. What about in our country? This is again data from 2013 to 2019. Each of these bars is a year so this is 2013, this is 2019. So you find that halal, the issue of halal haram, the religious issue, and the issue about the content are two things that is big with the Malaysian public. And also our alternative medicine friends are doing a good job of promoting themselves. So this is also a big thing here in this country. Internet doesn't play such a big role, and adverse reactions, which is very high in Western literature, seems to be not so important among our Malaysian parents. But you will see that in 2019 is slightly increased already. And then the family influence, if your mother-in-law is an anti-vaxxer, then you're more likely your children will not be vaccinated. So this is the local situation. This is what's happening in our country. And when we look at all the respondents, 99% of them did not have any problems with vaccination. They all agree. But among those who worried or had doubts, most of the doubt was due to MMR. Now, MMR worry is related to this paper. I'm not sure whether you have known this. This was a paper written by Andrew Wakefield in 1998 and published in The Lancet. It linked MMR with autism. And but in 2004, this investigative reporter by the name of Brian Deere investigated and found that all the data was fraud, and it took another 6 years before the journals actually retracted it. So there was 12 years of period when this information was spreading all over the US and all over the UK and then the US and then the world. Now, what has happened to this? Now, this is a graph showing the effects of vaccination and what has happened to measles after the vaccination from up to 2007. This graph shows the ones in yellow bars are the percentage of MMR uptake, and the blue line is the cumulative cases of measles. Remember, in 1998 was the paper published. There was a slight drop in uptake and then there was a little hump of cases here, and then it dropped to 80% in 2004. And then you had a sudden increase in cases and with a few thousand deaths of children because of measles. So this is the effect of that paper. Just to go through what our healthcare workers think about vaccination. This is Dr. Zambri's paper looking at influenza vaccination among healthcare workers. Now, most of the healthcare workers above the age of 40 were not vaccinated between 40 and 50 years old. All right, and the reasons they gave for not being vaccinated is because they thought they did not need the vaccine. They were worried about side effects. So if healthcare workers are worried about side effects and they were also doubtful about the efficacy, if healthcare workers are worried, you can imagine what the public will think. And also there was no compulsion by the employers, that means the hospitals. You do know that when you start working, you will need to get influenza vaccine yearly. Now, our advice matters. So this is taken from a publication where when the doctor recommended and offered the vaccine, there was a 42.9% chance that the patients will take influenza vaccine compared to when it is not recommended at all, or you have just recommended but not offered the vaccine. So our opinion as healthcare professionals is important, and that also affects the way you write on social media as well. As long as you're identified as a doctor, you will be identified as a doctor, whatever you say. Now, I just want to go through this Immunized for Life. This is a program that I run, all right? This is a program that that is with the Ministry of Health and the Malaysian Pediatric Association and the Malaysian Society for Infectious Disease and Chemotherapy with some industry support. It is an expert-driven community education program that's developed to support the WHO's call to increase vaccination promotion. And the target is basically everybody in the whole country. And it was launched in 2013 by the Director General of Health, and the goal is actually to position immunization as essential and also to help curb vaccine hesitancy and refusal. And this was launched in 2013. This is the website address if you want to visit it. Now, when you look at immunization advocacy or immunization communication, it involves a primary communication between the doctor and the patient, and also secondary through media. Now, so this is a training that was done by Immunized for Life to train healthcare workers on empowering them on how to address vaccine hesitancy and refusals in the clinic. And we've done this in 4 sentinel places in the whole country, concentrating on states where there was the highest numbers of vaccine refusals. And also, when you look at the multiple platforms of immunization advocacy, will include offline, where direct encouragement with the healthcare professionals, as well as printed material and traditional media, and then there's online, which involves social media as well. So this is vaccine refusal in Malaysia I showed you earlier, and you see that it's plateaued. And as I told you, the Immunized for Life program was started in 2013. You know, although I don't think this is true, but we like to believe that it may have helped in flattening out this curve. And we see it less in 2020 and 2021. Maybe there's been some success. But it's not just us. There's Dr. Budak, there's M3, there's also Med Treat My, and then Ministry of Health, and also Masyarakat Kena Tahu. Right? These are all social media, and also the religious bodies that also have come up very strongly and also are promoting to the public. Now, I just want to end with this future vaccine development. This is something that is difficult to look at, but there are many newer technologies that's coming up. Messenger RNA, as Dr. Firdaus said, was one of them. But there are also other methods of giving it, like the flu mist through the nose, as well as skin patches, which are being tried at the moment. But if you look at the vaccines, there's the Avian Influenza vaccine, which has been worked on by GSK in their Prependrix, and then by Sanofi Pasteur as well. This is for avian influenza to prevent a pandemic that they thought would have been caused by this virus. Chikungunya virus vaccine is another. There's no commercial vaccine at the moment, but there are experimental ones that are being worked by the US Army Medical Research Institute Infectious Diseases, and this is in phase 2, and most of them is in phase 2 trials anyway. So, and then there is Clostridium difficile, which causes diarrhea, and there are 3 candidates as well, but all in phase 2 and phase 3. Now, COVID-19 is what Dr. Firdaus mentioned earlier. There are many vaccine candidates that are already in phase 3. He mentioned 3 of them, and also the Russian one, the Gamaleya vaccine. There's also the Indian vaccine, Bharat Biotech, and then Murdoch Children. So there are a lot more vaccines coming our way. Dengue virus vaccine is interesting. We had the dengue virus vaccine called Denvaxia. You know that dengue is endemic in this country, and we were all looking forward to this. But Denvaxia that was made by Sanofi Pasteur was introduced, but they had some problems in that the dengue negative, if you were seronegative and you were given the vaccine, and if you get an infection, you get a much severe infection. So this has now been put on hold, and it's not been approved here yet. There's another vaccine being worked by Takeda, which is going to come up, which is already in phase 3 now. And there is another one by MSD, which is coming up with a dengue vaccine as well. So these are things to look out for. But dengue is a very interesting disease and a very complex disease. So when you start studying the dengue later, you understand that there is something called, there is something where you actually stimulate the response and you get a severe secondary infection. Ebola virus, there are 12 actually candidate Ebola virus vaccines, but they're all not yet approved for use. This one was approved by the EU in July of 2020. Enterovirus 71 that causes the hand, foot, and mouth disease and the encephalopathy. This is there are 5 possible vaccine candidates, but we haven't heard very much of it. Now it's being led by Taiwan. The HIV vaccine, there are no vaccine that's being registered, but the RB144 vaccine candidate showed some partial efficacy in preventing HIV. Malaria vaccine has been talked about for a long time. Currently, there's still no vaccine against human malaria, but there are more than 20 vaccine candidates. So as you can see, all these vaccines have taken a long time because not much money has been pumped into it, and we don't have that many cases to test on. Whereas in COVID, the cases are walking on the streets and there's a lot of money pumped in. So you don't have to wait for a number of years to get the sick people from COVID. Zika virus, Zika vaccine is another one. Currently no vaccine that's registered. There's a DNA vaccine that's developed by the NIAID Research Center. And there's also a modified messenger RNA vaccine by Moderna, and this is in phase 1 and phase 2 trials, and then phase 1 trial with a live attenuated vaccine. So there are a lot of vaccines from Zika virus that's being worked on as well. So these are all potential for those of you who are more inclined to lab work. So you're inclined to lab work, there's a lot of research to do. So what is our role then as healthcare professionals? These are the things that the values we hold on to. We shouldn't be dismissive. We should earn the trust of our patients. We should be vigilant, proactive, earnest, and keep ourselves updated. And we should show that we care for our patients. And we should also be able to differentiate vaccine hesitancy from anti-vaxxer, because if you're hesitant, you're not an anti-vaxxer, you're just not sure. So as far as we are concerned, we are all actually vaccine advocates. And we should take every opportunity to discuss about vaccination with our patients and our friends, and then we should try and understand why parents are adverse to vaccination, and we try not to antagonize anti-vaccine lobbies. Well, you can let Dr. Firdaus antagonize them because he's able to do it, and people like me, maybe we can do that as well, but you should not try and antagonize them because it will just lead to nothing. And vaccines don't save lives, it's vaccination that saves lives. And this is the website again for you in case you want to look it up and see what Immunized for Life does and what kind of information is there, and you can share with your friends. Thank you very much, and I look forward to the discussion. Sorry about rushing.
Thank you, Professor. Oh, sorry.
Sorry about rushing.
It's okay. It's okay. It's okay, Prof. All right. Thank you, Professor Dr. Zulkifli, for the delightful and impactful presentation. And also thank you, Prof, for providing a lot of statistics and evidence for this heavy vaccine issue so that we know that what is happening all around the world. We are now fully aware of how vaccines were made, its law and regulation, and some of the reasons why in our community there are some hesitancy hesitancy and refusal against the idea of taking a vaccine. We also get to know that the ways of our Ministry of Health addresses these issues. And last but not least, we took a glimpse of how vaccines would be in the future due to the current situation, whereby we are all equipped by advanced technologies and researchers. Once again, I would like to thank to our wonderful speakers for the night for the very interesting and unforgettable knowledge that they were kind enough to share with all of us today. Now, it seems that we have quite a number of curious audiences together with us tonight. We have handpicked some of the questions in the chat box. Therefore, I would like to be the representative for them to ask some questions to both our speakers and let your curiosity be answered. So the first question is an audience from our YouTube live. Is from Hashish. The question is, how did the COVID vaccine be produced and researched relatively fast compared to other vaccinations like polio or smallpox? Dr. Ahmad Firdaus, would you like to address this question?
Okay, maybe they missed the part just now, but let me explain again. First of all, why is it so fast is because one is the funds, as mentioned earlier. COVID-19 compared to, polio was ages ago. MMR, mumps and all were ages ago. For COVID-19, this is something that affects everyone. It affects every country in the world. It affects all sectors, economic sector, educational sector, aviation, everything. So that's why people are looking for something to beat this pandemic as soon as possible, because they just can't take it anymore. So that's why it's one is the funding aspect. Then there's a technology. So because of the advancement in technology, we have the mRNA vaccine, we have the sharing of information between one country to the other, so things can go on much faster. And then regarding the parallel trials, compared to the previous vaccines, parallel trials are meaning the trials or studies are conducted at once. So compared to 5 years for phase 1, 5 years for phase 2, 5 years for phase 3. So that itself would take up to 20 years. But compared to the current one, because of all these sectors, there's centers are everywhere in the world, so this can be done faster. And then, as Prof mentioned just now as well, the subject or the sample or the people who have COVID is everywhere compared to polio, compared to all these other diseases. It's not as readily available, such as dengue. If you see dengue, it's more of a Southeast Asia or tropical country disease. It doesn't affect the whole world. So one example is when there was a dengue outbreak, or it's not really an outbreak. There was one case in Japan, and the Ministry of Health there went bonkers because dengue was something that they didn't encounter before. But for us in Malaysia, it's like, I see it every day. So, however, Malaysia or tropical countries aren't countries with a lot of money. So not a lot of funds will be put into the development of the dengue vaccine. However, it is on its way. But as compared to dengue, COVID-19 involves the whole world. It involves all these big countries, Italy, UK, US, New York. I was there. I was lucky to get away from it last year. It was just 1 week before the lockdown. I was in New York. And to be honest, the US system was bad. They didn't do anything. They didn't scan, they didn't screen anything. So yeah, so it involves the whole world. That's why it needs to be done as fast as possible. Prof, nak tambah ke?
Tak ada. I already mentioned it just now.
Okay, thank you, Dr. Ahmad Firdaus. I think that our country is privileged enough to get this, to be exposed to different types of vaccines. Okay, moving on to the second question. Just now, Professor Zulkifli has mentioned about mandatory and compulsory vaccines. So there's a question regarding that. It's from Irliana Ibrahim. She's asking, I'm just wondering, why is vaccine not mandatory in Malaysia? Why can't we impose penalties like Slovenia and Singapore?
All right, we can do that. The thing is this: if you want to impose something like that, we had this discussion. I was one of those who actually proposed and tried to get the government to actually make it mandatory. This was discussed, the Ministry of Health at a very high level, And the data that I showed you earlier on was actually from a presentation by Dr. Sabrizan that time. And the reason why we haven't made it is because you need to have a government that is strong enough to say that we want to make it mandatory. Number one, there has to be this political will to do it. Number one. Number two, if you do it, you have to have a vaccine compensation program. Like in America, there is a vaccine compensation program where you have a special court and then you give away a compensation if you are vaccine injured. And in fact, in America, your vaccine injury is very minimal. You can still get some compensation. You know, it's a bit gone the other way. And then the other reason is, if we penalize somebody, we have to make sure that the vaccine is available to everybody. Now, there are a lot of people in the B40 group where they cannot take leave, you know, because they are day in earners. So if they take leave just to bring the child for vaccination, wait at the KK for half a day and then get vaccinated and come back, they've lost the whole day's income. So that causes a problem for them. And the Ministry of Health doesn't want to do it because of these issues. So if we want to do it, we have to be in a position where we have to support everybody. Now in Singapore, they have $5,000 fine. But then when you talk to their health officials there, they have never even done that. They've never fined anybody for not being vaccinated. So I think that in the final analysis, when the Ministry of Health said it is better that we, number one, make vaccines easily accessible to everybody at any time. Number two, we try and convince them that vaccination is the way to go, and that we should actually make them come forward for it, voluntary basis. Now, there's a question of why can't we make it compulsory and prevent children from going to school if they are not vaccinated? That was done in some countries. Now, it's done in the United States, but then we are a signatory to the CRC, the Child Rights, Convention on the Rights of the Child. All right, we are signatory to the Convention on the Rights of the Child, and under that signatory, every child is entitled to education. So that's why our primary education is free, and so because of that, we cannot force people and say, if you're not vaccinated, you cannot come to school. So I hope that answers your question. Yeah.
Thank you, Prof, for giving your honest opinion about this topic. We hope that the Prof's answer could clear the doubts of the person asking. So the third question, moving on, the question is directed to both Dr. Firdaus and also Prof. Is from Hazika Hassan. She's asking, do you agree that the awareness for making vaccine of syllabus awareness or campaigns should be given at an earlier age, like primary school, so that they could understand how the vaccine works? Since some parents have already been influenced by some conspiracy theories. If yes, is there any future planning from government or the healthcare sector on this?
You want me to go first? Okay. As far as education, yeah, I think it will be introduced. I think that is the plan. I think Ministry of Health is going to talk to the Ministry of Education, and they will be introducing it probably in late primary school or early secondary school. The second question is related to what already? What was the second part of the question?
Any future plannings of the government and healthcare?
In vaccine anti-vaxxers or vaccine hesitancy?
I think it's against hesitancy.
Hesitancy, yeah. No, I think in hesitancy, the idea is actually to convince them and to. You have to remember, yeah, in the whole idea of things, vaccine hesitancy is very small, and vaccine refusal is even much smaller. So that small number of patients, small number of parents will not really affect the whole. But then, because the Ministry of Health wants to get as much coverage as possible, because we are very proud of our immunization program at 98% and 97%. So they want to keep it up. So when there is a refusal, there is a protocol that's followed. So that means they will be approached by the nurse first, and then the nurse will bring it up to the MO, and then the MO will bring it, cascade it up to the family medicine specialist, and then they will be handled. And when, if the parent really decides that they don't want to get the vaccine at all, then there's nothing much that they can do. But this is something that they accept. Now, how do I handle this sort of thing? I mean, you may want to ask, how does a practitioner like me handle something if a patient comes like that? I will basically give them the facts. If they don't want to, I listen to them, right? And it's important for you to listen to them because they have their ideas. The ideas may have been fed by the internet of their friends or their mother-in-law or somebody. So, and we listen to them, and then we tell them what is wrong with the ideas that they're thinking about. And usually you can come to some sort of a compromise. Now, the problem here is when you have a lady who's delivered, the husband refuses to have the vaccine, tells the nurse, no, tak nak injection at all untuk anak saya, and then and he leaves. So you can't talk to him. You see, this has happened, and this is very much a Malay thing, like Malay men are like that somehow. Okay, sorry, Alicia. So and so there's nothing much I can do, but I can talk to the mother, and I will explain to them what, and then all the mother-in-law and the in-laws, and explain to them. But usually they don't come back. They probably will not get it. So that's okay because that's a small number. Right? So in the end, it is their decision as far as this country is concerned.
Dr. Firdaus, do you have any additions? Yeah.
On my part, I think education is the key as well. You need to differentiate between hardcore anti-vaxxers. Anti-vaxxers, you cannot say anything, they won't really accept you, but we are after the ones, the fence sitters. So it starts off with the education aspect. And for doctors, unfortunately, doctors, we don't really communicate properly to our patients in terms of sometimes we tell them about data. Okay, this is how much, this is percentage, but we're not focused, or we are not trained to inform the public or the patients in a very very simplified manner, all these analogies, and it becomes worse when you go to states like Terengganu, Kelantan, Sabah, Sarawak, where you don't know the dialect. So communication is key, and how you present those facts in something that can be related by the patient is the most important matter.
Alicia, I missed out one thing just now because Firdaus just mentioned something that I should have put. There was a slide I had which I actually forgot to include. This was the refusers based on state. So the states that had the highest refusers were actually, if I remember correctly, they were in Kedah, Terengganu, Selangor. So these are states where, very rural and and Kelantan. So these states are the ones that have high vaccine refusers. And I agree with Firdaus, it is about education. And I gave you the IFL website, www.ifl.my. That's the Immunized for Life website, and that's for the public. So the way that it's communicated is not by facts and figures and diagrams and numbers, it's by stories. So what's important is the stories. We actually have an interview of a polio survivor. So then what polio is all about and what that has caused to the virus. So I encourage you to just have a browse through the website and see what you think about it. And if
IFL has a lot of nice videos. And, I think the graphics
we spend a lot of time and money on it. So
I guess to summarize Dr. Firdaus and Prof. Zulkifli's opinion, I would like to summarize that talking about vaccine hesitancy, we should focus more on the educational process, like listen to them and advocate them about the correct statements of the vaccines. All right, moving on to the next question. Next question is directed to Dr. Firdaus. Some people are against the idea of vaccination, especially COVID-19 vaccine, because they are afraid of getting severe illnesses. My question is, how do we ensure that COVID-19 vaccines won't cause such effects to them?
Okay, this is it's a losing battle lah. I mean, I look quite tired with all this. Tapi what I want to say is, macam mana? We are at a losing battle because compared to the BOMOs, compared to all these other sellers of fake medicine, we can never say something is 100% effective. We can never say something is 100% safe. So that's why we have all these data. Okay, this is 95% efficacy. Efficacy rate is 95%. Adverse effect is real. If you look at the latest press statement by the Minister of Health, he has noted that there is quite a number of side effects arising from the COVID-19 vaccine from Pfizer BioNTech. I mean, I myself had friends who had severe lethargy, feverish, but these are things that are expected. But once it becomes available to the public, they don't know how to take that into, I mean, they don't know how to put it into context. I saw someone saying, asking a question about this doctor who kept on saying about all these side effects of vaccine, frontliners are being used as lab rats and everything. So whatever he said, those are true. Side effects memang ada, it will be there. Okay. However, you have to put it into context. For example, for Pfizer BioNTech in US, out of if not mistaken, 1 million vaccines given, only 11 cases of anaphylaxis was recorded. And anaphylaxis is being monitored, meaning from the flow of the vaccine process, as I've gone through already, you go, you line up, and then you agree upon that you are safe. I mean, you are healthy. You have any previous side effects or any medications or not, then they will let you in. After the vaccination, there'll be a 15 to 13 minutes observation because that's the time when the anaphylaxis will occur. After that, if such reactions or adverse events do occur, you can make reports to MySejahtera. You can just key in and the data will be available. So because we have to do things based on facts, and each of these facts have to be transparent. So sometimes when we say something directly, macam we say, okay, ada 4 people died after taking vaccination. Okay, that's what happens in the what's been published in the papers or the news portals. But then they don't explain further that 4 out of, I think this one was in Europe, 4 out of how many vaccines given, and then compared to the normal rate of death in that country, it was actually lower than the standard one. So everything needs to be put in context. So when you explain, you need everything in context. Prof nak tambah anything? Takut I silap.
Yeah, no, that's true. We have to take everything in its proper perspective, because you can look at the deaths among old people, and you can see that X number of old people die. But in Malaysia, 75 people over 65, 75 people over 75 will die every week. So if you're going to have show that there's an increase, you have to show that there's more than 75 people who die per week in Malaysia. So that's how you look at it. You have a baseline data and then you look at what's above that baseline. Okay, we have a lot more questions, Ni.
Yeah, we are flooding with questions, but unfortunately we have to handpick the some of them only. So thank you, Dr. Yes, Prof.
They're good questions.
Thank you for clearing out that everything has its own side effects, and there are a lot of alternatives way to get treatment and approaches to overcome them. So the next question is an interesting question. Maybe Doctor and Prof can answer this. There was a viral issue before regarding a medical doctor who is an anti-vaxxer, and disadvantage of vaccine was spread by the individual. With that, I would like to ask, what is your opinion on someone with medical background who is an anti-vaxxer? What are the advices for us, the medical student, to not be an anti-vaxxer in the future? Yeah.
I start. Okay. No, we hope that you don't become an anti-vaxxer, because I hope that you believe the science of it. And if you read the science of it, then you understand what it's all about. The thing is, that there are people who want to spread fear. We are okay if you don't want to give a vaccine to yourself or to your child. Yeah. But when you start telling other people that giving this and that and all that, then you become an anti-vaxxer. So we can only hope that you don't. And the thing is to stick to the facts and then learn about proper epidemiology and all that, and critical thinking. Firdaus, you can continue.
Okay. So in terms of that
Oh, one more thing I forgot. If there is a doctor who's actually spreading anti-vaccine news, there's an avenue for others to report to the MMC, yeah, and this has been done with a doctor before. No, sorry.
MMC they can do something about it. Okay. In terms of doctors or medical practitioners being anti-vaxxers, okay, one also need to consider the background. For that, I think we're referring to the same video. It's been viral by multiple doctors. Orang kampung all somehow they can suddenly understand things. For that particular case, you have to see the background. Has anyone looked at the background? Okay, maybe after this you can look at the background. That doctor is an aesthetic medicine doctor. Okay, so he runs an aesthetic clinic. If you look at his past videos, just in January he was posting about ubat urut lelaki. Okay, then in March suddenly he becomes a COVID-19 specialist. So you have to take that into consideration. Another one is an aesthetic doctor might not have the same insight as a ICU specialist, an anesthesiologist working in the ICU. They might not see cases such as pediatricians. They don't have to deal with seeing kids die because of vaccine preventable disease. They do not see the effects of happy hypoxia. They do not have to do CPR suddenly on someone who just collapsed in their ward. So you have to see this into context. I think if you want to see how someone approaches this, I think Dr. Musa is one person that you can look and see how he actually conveys messages that can be mencengkam jiwa lah. Okay. So I mean, one thing is each doctor has their own specialty. Whether he sees things properly or not is a different matter. Okay, doktor memang ramai. There's a lot of avenues. There's a lot of specialties. Not everyone has the privilege to see things in a proper way. Okay, once you guys become doctors, make sure you see things. The first death is always the most painful. It's almost the most traumatic. I still remember the first death that I saw in the surgical wards. So if you don't see death, if you don't see the impact of diseases, then you don't know the impact it has on the general population, on the public health.
I see. Okay, so I think that this is like an eye opener for all of to all of the medical students. Now we are aware that there are medical practitioners are also included to be a part of this problem too. So we should be aware of that always, and to not be an anti-vaccinist when we become a medical doctor in the future. So seems like we are running out of time. So I just this is the last question. Hello, Doc. Do those who recovered for COVID-19 need them vaccine as well, as their antibodies must have recognized the virus, right? Yeah. This is from Nurin. Yeah. Maybe Prof or Doctor want to give your opinion on this?
So as of now, the policy currently is those who had or recovered from COVID-19 does not need vaccination. So they will be postponed for 6 to 9 months. So because there's some studies that show that even after 9 months, the antibody level is still very high. So we do not need to vaccinate them. Maybe in the future, because currently we are dealing with issues of inadequate. I mean, the demand is a lot, but the companies are not able to supply uh, the vaccines in a large quantities. So that's why if you can see the data, our vaccination drive is going on quite slowly. There are still some doctors in the government sector, doctors in the private sector who are unable to get vaccinated because of the supply issue.
Yes. Thank you, Dr. Firdaus. Prof. Zulkifli, do you want to add on to anything?
Yeah, that's a good question here. I mean, there are a lot of good questions, and I think this should be answered because I usually don't like to leave a lecture with people having questions. There's one here. What is the best way to you don't mind, yeah, Alicia? I read the question here. What is the best way to convince the anti-vaxxers on the benefits of vaccination? If you're approached by an anti-vaxxer, you don't try and convince them about the benefits of the vaccination because their mind is already fixed. You can spend 2 hours talking to him or her, and you won't be able to convince it. A very famous vaccinologist once told me before, you never try to fight with an anti-vaxxer because it's like fighting with a pig in a pig pen. At the end of the day, you just end up all dirty, and the pig is happy because you're fighting in his home, but nothing gets solved. So that's the analogy he used to tell me. So if there's an anti-vaxxer, don't try and antagonize. Just state your facts, remain calm, and then after all, you know your what you are and what your facts you have. So there's no need to convince that person. That person, on the other hand, has to convince other people to believe in him or her, and that may be difficult, you know. Looking at the patients who might come across now, they actually shun anti-vaxxers. Okay, let's see the others.
Okay, I guess we have a bit more time to answer more questions. So the question is, some people are hesitant on taking COVID-19 as they will undergo a very quick development process. They are afraid of long-term adverse effect that may occur years later. How should we as medical students approach this issue?
Data lah. It's all about data. That's what I said. We are at the losing end because anything we do, we need to be backed by data. So like someone said, the trial is only going on for 1 year plus. So how do we know how it will affect in the future? So one is we don't really know, okay, but we have the historical data. I mean, some of the components are the same as all the other vaccines. So in terms of the long-term effect, there shouldn't be any. Most of the effects we see immediately or within the next few hours, 24 to 48 hours. So yeah, long-term effect, so far, no. I mean, the studies on autism, it's been going around. It's been debunked multiple times. It's the same thing. And then whether or not we would need a booster dosage later on, it's still, I mean, we still need to see how it goes. That's why, as I said earlier, we need that Swiss cheese model. Vaccine isn't the only way forward. Vaccine isn't the only solution. That's why we need all these other methods to control the disease. Yeah.
Thank you, Dr. Firdaus, for clearing out all of our doubts. There are many, it seems like there are many curious medical students. Majority of the questions are from medical students. This one more question is from a medical student from UPM. And his name is Fong Yan Bin. He's asking that I would like to ask, since the new variant of COVID-19 virus has emerged, studies have published that NEJM2 weeks ago that show a significant decrease in the efficacy of various types of vaccines, which AstraZeneca most severely affected. So in your opinion, there are two questions. Is it likely that the effect of vaccines will become lower than the required threshold for the herd immunity in the near future, and hence make the current vaccination program become worthless? Yeah. Would you like to answer the first question,
Of course.
Prof?
It's related to this. So the second question is also related. Okay, this person, I must congratulate her or him. You know, for a first year student, reading the New England Journal of Medicine is you know, is commendable, and I'm sure you'll go very far in your career. Now, we don't know actually the effect of the vaccine, and it is true that the New England Journal says that the efficacy to the new variants is less. And at the moment, if you ask us, and based on the data that's available, we really don't know. And then you said here the second question is, does it mean that we lengthen the MCO period? I don't think so, because I don't think you are right. I don't think the MCO is a long-term solution. If you go by, okay, let me look at historical. I told you just now, I take you through history, right? So let's look at the Spanish flu. This is 1918. Right? The Spanish flu in 1918, just after the First World War, actually took 3 years before it completely was done. And in I think it was San Francisco, when it was 4th of July, and you know, they said that everybody can come out and celebrate at the 4th of July. And when everybody came out, celebrated and all that, and then there was another wave of influenza, and thousands of people died. So and then came the vaccine, of course, the flu vaccine that we now use, which is like every year. And then it saw a decline, but the decline did not happen because of the vaccine. It just declined by itself because of mutation. You know that the new mutations, the mutations in the UK mutation actually spreads easily, but mortality is less. And the ones in South Africa also spreads very easily as well, but I think the mortality remains the same. But then you get an attenuated version of the virus after some time. So what I see from COVID is that we will probably live with COVID just like we live with influenza. And whether we need to get ourselves vaccinated every year, we don't know that yet. I mean, personally, I had my first shot. I wouldn't want to get every year.
All right. Thank you, Prof, for your opinion and interesting information. So this question asking, the true nature of the virus is still uncertain and has shown the unpredictability in this world. So if the SARS-CoV-2 were to evolve exponentially due to a certain interaction, in analogy that the virus becomes a super saiyan, is it possible for it to break all barriers for humans, including the vaccine itself? Also from a medical student.
How can I explain this? So you're saying that this virus can be spread exponentially. It becomes super sporadic. I think that's what I think that's the super spreader term all over the world. So in actual fact, there's a lot of things we need to learn about COVID-19. SARS-CoV, there's a lot to learn within the span of 1 year. There's so many things we have learned and also the SARS-CoV works in very peculiar ways. Some of the managements that we are used to may not be feasible or may not be the same. And then we also encounter patients with long COVID, meaning after they've recovered from COVID-19, their symptoms persist. They still have shortness of breath. They have anosmia, unable to smell, and myalgia, arthralgia, all that. So vaccine, as I said, is not the silver bullet. It won't cure everything. It won't stop COVID-19. Whether it becomes a super saya version, we don't know yet. But what we know is, as far as we know with the data available, the vaccine that we have given would prevent long COVID, would prevent complications of COVID-19, would hopefully it will prevent the further spread of the vaccine. So as you said, memang banyak benda kita kena belajar, a lot of things we need to learn, a lot of data we need to analyze. We may have to deal with COVID-19, we have to live with it. That's why there's this new norm, so norma baru. So yeah.
Thank you, Dr. Firdaus. So I guess there's a lot of things that has to be yet to be discovered, and everything is still an educational process, and we're going through a lot of progress right now. So that's good for our country itself. Okay, I think thank you everyone. That was certainly an interesting and overwhelming session. We hope that we had more time to receive more questions and to answer all of your amazing and outside the box questions. But unfortunately, the time is not on our side now. So to end the session, next, we would like to present the virtual certificate of recognition and appreciation for joining the ABCs of Vaccines webinar to our honorable speakers. So first, we would like to present to Dr. Ahmad Firdaus. Please keep your video switched on and smile as the multimedia team would like to take a photo.
Okay, I take the photo. Okay, 1, 2, 3. Okay, thank you, Doctor.
All right, okay. So moving on, now we would like to present to Professor Dr. Zulkifli Ismail. Please switch your video and smile.
A second, yeah. Okay, ready? Smile, 1, 2, 3. Okay, great. Thank you, Prof.
Thank you.
All right, now finally, we would like to ask everyone to switch on your videos as we will like to take a group photo. Everyone, please put on your biggest smile.
Okay, is everyone ready?
Mm-hmm.
Okay, I take the photo now. 1, 2, 3. Okay, nice. Okay, thank you, everyone.
All right, thank you so much, everyone. So finally, I would like to say that the V Project 2021 has now kick-started our own merchandise sale, selling our own very limited edition high quality t-shirt and tote bag. All the profits earned from this merchandise sale will be channeled to purchase the PPE for the frontliners and healthcare workers at our very own Hospital Chancellor Tuanku Mokris HCTM. And to all participants, get ready to participate in our very own first ever creative short video contest. The theme is Spare Our Lives, Vaccine for Life. In this contest, anyone can join. All you have to do is to spend a minute of yours to record a video about anything related to the theme, and you will stand a chance to win cash prizes up to 300 ringgit. The duration of the video is 1 minute and it must be posted up on your Instagram account. The submission deadline is at 11:59 p.m. on the 11th April 2021, which is on the Sunday. And to obtain more details about our upcoming online webinar, merchandise sale, and creative short video contest, kindly visit our social media accounts on Facebook and Instagram at the V Project 2021. Both links for the video competition as well as the merchandise are also available in the chat below. And also, kindly a gentle reminder for the first year students, please do scan the QR code on the screen and fill in the feedback form in order to complete your attendance for your V points. On behalf of the VB Project 2021 and Persiap UKM, I would like to thank Professor Dr. Zulkifli and also Dr. Ahmad Firdaus for imparting valuable insights and inspirations in this webinar. We will have your virtual certificate emailed to you after the webinar. Our committee members shall escort you to the guest room for a short postmortem regarding tonight's event. Thank you again, Professor Dr. Zulkifli and Dr. Ahmad Firdaus, and to all the audience who have been joining us for tonight. We look forward to having you for our upcoming webinar sessions. Thank you all and have a great evening.
Lisa,
Yes, Prof.
can I answer the questions online? There are some questions here and I've been answering it. Will they be able to read it?
Sorry, Prof. Sorry. The multi. All right. Sorry, it was interrupted by the music. Okay, Prof, you can continue.
Sorry, oh no. The questions, I'm answering them now. So will they be able to see the answers if I answer online now? Because there are a few questions.
Would you you would like to answer the questions in the chat box, or you want to explain?
I answered the chat box already. Will they be able to read?
I don't think so, Prof, because once the meeting ends, everyone is left.
Oh, that's unfortunate.
Yeah, unfortunate.
Okay.
Can they still see us? Sudah. Can they still see us?
I think they can still. Yeah.
Oh, okay.
Now we're waiting for the post-mortem guest room. To Dr. Firdaus and Prof. Zulkifli, have you received any link for the postmortem room in the WhatsApp group?
It's in the WhatsApp group.
Or you can click it in the chat box. Yeah. Our director has sent it.
So do I leave this group? I mean this.
Yes, that's it. You just click on the link and leave this meeting.
Which link? The UMITH.
Yes, Prof.
It's in the chat box, so anybody also can click it and join.
The meeting is only, the postmortem room is only for the committee.
So I can.
Yes, Prof.